all doing. I hope you're all doing fine. I'd like to introduce our host, Dr. Muhammad Darwish. Other than being my sister, she is a lecturer at IAU and she is a PhD candidate. Is my voice clear? Yeah, and she's a PhD candidate, a life coach, a family counselor, and a professional international trainer. The topic that we'll delve into today is emotional intelligence in the workplace, how it ties into our day-to-day activities, our interactions with ourselves and colleagues. So without further ado, let's go ahead and start.
Good evening, everyone. Assalamu alaikum wa rahmatullahi wa barakatuh. As my lovely host and sister said, my name is Manab Darwish, and I'm a certified life coach and family counselor and a professional international trainer, as well as a PhD candidate in Imam Muhammad bin Saud Islamic University. Although my field of studies has nothing to do basically with life coaching, it's a passion of mine, and I am delighted, honored, and it's such a privilege to be here with you tonight. I would love for the next hour that I would give you everything I've prepared for you. And if you have any questions, you can either ask in the chat or raise a hand to enter it via the microphone. Please note that this meeting is being recorded and it's going to be uploaded on YouTube in case you wanted to go back and revisit the information presented. So let's start with a brief introduction to the subject. Emotional intelligence is a vast, vast subject. It's very broad and cannot be summarized in an hour, if I'm being honest. I'm just trying to give you today the most practical ways as healthcare professionals that you could use and utilize in the workplace. So the first thing that comes to mind when we talk about emotional intelligence, because the word emotion in it, there is a misconception that says emotional intelligence is about love life and couples and relationships. It includes relationships, but it's mainly your relationship with yourself, your relationship with your surrounding, and you will notice by the end of it that you could use a lot of the practices and the activities we're going to talk about today in your day-to-day and even outside of the work. So it's not just pointed at your work or what you can do in the vicinity of the work, although I know as people who work probably 12-hour shifts most of the time, it is important to have that, but it's actually much more broad and you can apply it in a lot of aspects in your life. So today's objectives are we're going to explain what emotional intelligence is and is not, and why would you care about it, especially at work? What is the difference between emotions, feelings, and moods? How can you change and regulate your emotions on a day-to-day basis? Benefits and practical applications, especially in the healthcare, and we'll have a couple of interactive activities and how to implement EI or emotional intelligence in practice. So just a general, and please give me your feedback in the chat. Have you ever, or did you ever encountered anyone who didn't get it when you were talking, said the wrong thing, did the wrong thing, or couldn't get along in the workplace, in your family, in your friend group, missed cues in a meeting or in a social event, you couldn't be around them, they triggered you so much, they made you uncomfortable all the time, or plain and simple just drove you crazy. This could be a colleague, a superior, a patient, anyone. If you could just tell me, like, probably you encountered some of these people, maybe all of them. So what we're going to talk about tonight is how to deal with these things. A lot of people think that it's outside of us, it's in the outside of us. What happens on the outside affects our mood, affects our emotion. And honestly, when you do that, when you give this power to someone outside of you, you are a captive to that person. A lot of people don't understand the concept of whatever happens in your life is under your power. You could use these emotions to your advantage or disadvantage. And this is basically the essence of emotional intelligence. It's how you regain your power and not let the outside factors affect your inner peace, your inner emotions, your feelings about yourself, about your work. A lot of people who are not able to be emotionally intelligent or learn it at some point of their careers, they tend to have burnout, they tend to have dissatisfaction in the workplace, they have occupational depression, and so on and so forth. So, emotional intelligence, what is it? It's understanding your emotions. It's the ability to know how you're feeling, why you're feeling those feelings, and what are you feeling in the moment. It's actually one of the practices that taught nowadays for kids in elementaries, and it's in the curriculum because it's really important to know and validate your feelings. We come from different backgrounds, different upbringings, and sometimes we weren't allowed to experience these emotions. We weren't allowed to express them, to learn what they are. So the thing is, with emotional intelligence, it is something you could learn at any point in your life. You don't have to have learned it at a certain point or like early childhood, or you wouldn't be able to do it. You can do it and you can learn it and you can master it at any age. And the more you read about it, there's a lot of resources out there, books. I'll give you a couple of recommendations and articles that have been published about this, and you could use it as a day-to-day practice. And I'm going to teach you a couple of techniques and strategies today that you could use and apply as well. It's picking up on others' cues. It's you being able to understand your emotions, be in your element, know what is your feeling and what's the other person feeling are, and manage your response and reactions to other people. So this is really important because sometimes we tend to do the impulsive thing and like say the first thing that pops in our head when a situation is happening or an encounter is happening. But being emotionally intelligent is actually knowing how to manage your response and adapt it to the situation in a smart way that does not result in a conflict, as well as managing your responses to your actions to yourself. We tend to criticize ourselves a lot. We tend to be harsh on ourselves sometimes. And this is actually the opposite of emotional intelligence. We're here, we're creatures, and we are humans, and mistakes happen, especially in your field. I know it's not as easy to make mistakes, but generally speaking, in the vast, when you look at it from a perspective, you have to be able to understand how to recognize what you're feeling, recognize your triggers, and work on them to avoid them when you're in the workplace or otherwise. Also, being appropriate in social situations. Being appropriate meaning how you respond to other, how you respond to verbal and nonverbal communications, developing relationships. If you have the emotional intelligence to learn who you are and who the other person is, to be empathetic, to understand the social skills that you need to have in the workplace and any other place, it is a way to developing and strengthening relationships in the workplace and outside. Also, treating others well. What is a misconception towards emotional intelligence? It's not being smart. You could be smart. You could have a very, very high IQ, but you're not emotionally intelligent, and vice versa. Emotional intelligence doesn't really correlate with being smart or having high IQ. Controlling others' emotions, understanding and empathizing with others' emotion is one thing. Controlling it's something else. It's manipulation. You can't manipulate other by being emotionally intelligent, is what I'm saying. Also, it doesn't have to do with being extrovert or introvert. You could be emotionally intelligent and be an introverted person, and you could be emotionally have low emotional intelligence and be an extroverted person, and vice versa. Is there any questions at this point before I keep going? Okay, I'm hoping we're good. If you have any questions, please write it in. Okay, what do I mean by being smart? Being smart is basically having good grades, smart, like book smart, having good grades, having graduated with honors, um, being able to solve problems like mathematical problems and retaining information. All these come into being smart and having high IQ. However, emotional intelligence, it's not related to that. You could be very, very smart. You could have been graduated with honors and you cannot, and you wouldn't have the emotional intelligence unless you practiced it and you learned it. The good thing is being smart is actually related to your genes sometimes. Like you come from a family who are geniuses or smart people and so on. And emotional intelligence does not have to do anything with your genes. You could, it's like a muscle that you train at the gym. You could learn it and advance in it and so on. Okay, so the definition of emotional intelligence, there is a lot of definitions out there, but I chose this one. It's the capacity to recognize, understand, and manage your own emotions. And I'm going to say it again. The purpose today is for you to look inwards. It's not to look at what XYZ of people are doing. It's to look at yourself, what's triggering you, what kind of emotions are you experiencing, and so on. And then understanding it, managing it. And I said manage and not control. There's a difference between controlling your emotions and managing your emotions. When you manage your emotions, it's you know what you're feeling, how you're feeling, and how or what you can do to deal with that feeling. Controlling your emotion is basically bottling up this response, and the more you bottle it and then add to it and add to it, there would come a point, the unfortunate, most unfortunate point, where you will explode. So there's a big difference between controlling and managing your emotions. You're supposed to manage your emotions, understand them, giving them a healthy outlet, which I will give you later, but not control them to the point that you're just basically a tank that's waiting to explode. Also, recognizing and influencing the emotions of others. And here we say influencing and not controlling. It's not the purpose to control someone's emotions or how they feel. It's to understand them, being empathetic to what they're feeling, especially in your field, especially in the healthcare. You need to be, you deal with people on a day-to-day basis. You have patients who are, you know, have from like simple illnesses to like very, very heartbreaking illnesses and so on and so forth. So understanding what the other person is feeling, recognizing it, empathizing with them, helping them with their emotions is actually a crucial part. Also, forming a crucial aspect of interpersonal relationships. The more you understand yourself and understand others, and sometimes we tend to blame the person in front of us because of something that triggers us that came from our trauma, our experiences, and it has nothing to do with the person in front of you. So when you understand people and when you understand yourself and why you're doing what you're doing and why you're feeling what you're feeling, and then give the person in front of you the benefit of the doubt and understand them more. You could just attribute what they're doing to something that happened with them, and it doesn't have to do anything with you. Sometimes we feel attacked, we feel pressured, we feel, and especially in high pressure situations like your field, I commend you for the amazing people that you are. And this is an honorable occupation, and I have tremendous respect for you all. But like I said, emotional intelligence, it's a tool, it's one of the tools that you could have in your disposal or at your disposal to be able to have a better occupation, a better life with your patients, with your colleagues, and so on and so forth. Uh, Especially in the healthcare sector, this is, like I said, it's very important. You deal with people on a day-to-day basis, an hourly basis. There's a lot of high pressure situations that you go through. So understanding what you're feeling and how you're feeling it and how to manage it, how to regulate it is actually a crucial aspect of this workshop. We have 5 key components of emotional intelligence. And some books say there are 4, some books say there are 6, but the 5 is the most popular. So this is what we're gonna discuss today. The first one is self-awareness. Being self-aware is understanding what you're feeling and why you're feeling it. Understanding, oh, this feeling comes from me. It's not what this person did to me. And we hear it a lot. Oh, they made me feel so and so. If you didn't have the trigger inside of you, no one on the outside could make you feel something. So being self-aware of your own triggers. Some people get triggered by people who are late, and it's just, for them, it's not acceptable, and it just sets them on fire and makes them angry and so on and so forth. The other person may not consider 5 minutes being late. So instead of getting angry, maybe a practical way of doing it is just going to that person, explaining, and I would touch on this again, but I will tell you a trick that is really, really beneficial. Whenever you want to go and ask someone for something or request someone for something, especially in your field, don't start the sentence with "you are late." You could start it in a different way of, I would appreciate it if I can get the medicine on time, or if you could, or if we could come and punch in on time, and so on and so forth. So self-awareness, being aware of what is yours, what's your feelings and what's not. Self-regulation, and again, it's not controlling, it's regulating your emotions. There's an outlets, and we're going to talk about them later, that you can do different practices, different way of dealing with your emotion, being angry, being upset, being dissatisfied, all these things. Some people go for a walk, some people take deep breaths, some people have coffee, some people listen to music, and so on and so forth. It's understanding what works for you. Today, I'm not going to give you a set step or steps to do and it will work for everyone. Self-awareness is recognizing what works for you to regulate your emotions, to make them less intense, and so on. Also, motivation. Motivation is a key component of emotional intelligence, because a lot of people experience burnout, feeling dissatisfied with their job, occupational depression, and whatnot, because they lack the inner motivation to pursue their goals. So being emotionally intelligent is understanding what are your needs, what you want, what is it that important to you, the values, the core things that you want to achieve in life, and being able to motivate yourself to do them. Also empathy, and it's an important thing in every field, but especially in the health sector. Being empathetic is very, very important. Understanding what other people is going through, being there in an active way. We could be sympathetic, which is a passive way of doing it, or empathetic, which means you sit and you actively listen to their problems. It's not that you put yourself in that situation, but you let them know that they're not alone. And the last component is social skills. And social skills is very important for you as a person in your life or in your career, because being socially skilled and being able to understand people's cues, why they're doing what they're doing, the nonverbal communication, and so on and so forth, is very important to building teams, having good morale, especially if you're a supervisor or a superior and you manage a team. Understanding and having the social skills, which is a key component of emotional intelligence, is very important for the team to run in a good way, in a positive way, in a functional way. Why should you care about EI or emotional intelligence? As healthcare professionals, healthcare professionals with high EI demonstrate 20% increase in patient satisfaction. So your patients are more likely to be pleased, satisfied, and able to heal better if you had high emotional intelligence. And notable reduction in employee turnover rates and burnout. Like I said, you work 12-hour shifts, it's a long time. And if you are dissatisfied, angry, disappointed, most of these 12 hours at a time, it accumulates. And if you don't know how to regulate these feelings, how to vent and let them out in a healthy way, the occupational depression rises, which leads to burnout and a high turnover rate. Also, we would think that in a good day, when I'm having a good day, I'm optimistic, everything is going very well, everyone is doing what they're supposed to be doing, and so on and so forth, that it's not important to think about emotional intelligence because it focuses on self-awareness, self-regulating, and so on. But what if you had a bad day? If you didn't have a tool at your disposal that you would understand, okay, this is what I'm feeling and this is what I can do about it, then it turns into an obstacle in your day-to-day activity and your ability to do your job, ability to be able to take care of your patients or your employees. Improving emotional intelligence will help us like our jobs more. It's very simple. If I'm happy where I work, I'm happy and I'm satisfied and I'm in a good mood and I'm excited and interested. And vice versa. If I'm not happy, if I don't like my job, if it's always stressful and I keep focusing on the glass half empty, then there's no way of me liking my job, which would lead me either to be passive while I'm doing my job or leave that job. Also, it helps us like our peers more when we understand, where our emotions start, where their emotions start, and the boundary between the two, to not let people, to put it in a practical way, get under your skin. Also, and be liked with your peers. You are more likely to be liked if you're not irritable, if you're not angry all the time, if you're not confrontational all the time, if you can't handle constructive criticism, and so on. And also be more effective in our job, which means giving what we need to be giving and what is expected from us in terms of healthcare, patients care, and also your day-to-day meetings and tasks. There's this saying by a Greek philosopher. It says, anyone can become angry. That's easy. But to be angry with the right person, at the right time, for the right purpose, and in the right way, this is not within everyone's power, and that is not easy, which is very, very, very true. Sometimes we have an encounter. Say you were going to work and there's traffic or an accident, and you're late because of that. So you're already irritable because you came to work late, and then you have an employee who didn't give the after shift notes in a right way. That's another trigger, and then another trigger accumulates, and then maybe something happens really simple, really not even this person's fault, and then you explode. Why? Because you've been controlling your emotions, accumulating this frustration until it reached the point where you couldn't control it anymore. And this is what emotional intelligence is. At this point, is there any questions? Okay. So the difference between emotions, moods, and feelings. A lot of people have a misconception about these three different things. They are very, very related. They are very intertwined. They come together sometimes, but one of them is a result of the other. So what's an emotion? What is valuable to understand? Why is it valuable to understand what are you feeling? Sometimes when you feel really, really angry, and then after like 3-4 minutes, you remember, oh, I haven't had anything to eat in like 6-7 hours. So you're basically not angry, you're just hungry. And you had a misconception of what that feeling is. Great. If you didn't have self-awareness, you wouldn't know or understand why you're feeling what you're feeling. You know how little kids, when they're sleepy, they start crying, and then we think, oh, they're throwing a tantrum. They're just crying for no reason. But they're sleepy. But they're kids, and it's okay for them to not understand what they're feeling. However, when it comes to adults, if you just take a step back and pause for 30 seconds and ask yourself, what is it I'm feeling right now? In any situation, that's a big step of understanding what are your emotions at the moment or why you're feeling what you're feeling. How do feelings affect our mood? Our emotions and moods are very, very contagious. Have you ever noticed when your boss or your superior come in and they're not in a good mood? They start the meeting not in a good mood, and you were fine. Come, in the morning, you came to work, you were fine, you were okay, there was no problems with you, but you walked into that meeting, and this boss was very angry, was very passive aggressive, was yelling or doing anything, and you come out of that meeting feeling, just a little bit of uncomfortable. And why is that? Because you didn't distinguish between what that person was feeling and you were feeling. Also, it could happen with a colleague. It could happen with your husband or your wife at home. Our feelings and moods are very, very contagious. So what's the difference between the three? Emotions they're very short, they're very intense, they have high intensity, and they're very, very short in terms of time. So you would feel like it's this burst of emotion, so to speak. It's a reaction to something happened on the outside, any type of stimulation that happened. It could happen that you could have an emotion of being joyful, angry, fearful, surprised, or more. The characteristic that comes with it, say you did something and you had your paper published. This feeling of happiness and joy, it's an intense emotion that happens because of a stimuli that happens outside of you. Okay, what is the feeling? A feeling is subjective. And so I want to highlight and underline the word subjective a lot because it comes from your emotions. So this instantaneous short-term feeling or short-term reaction actually cause a feeling. So your emotion causes your feelings, but not just causes the feelings. It's also based or influenced on your personal interpretation. How many times have you heard a story and someone said, oh, this person meant this and this and that, and then you said, no, I didn't hear that. So your personal interpretation actually participated in your feelings towards that subject or this story. Like you feel warmth or affectionate toward a loved one, or an embarrassment when you did a mistake. Say you will pronounce the word in a wrong way, you will feel the embarrassment. This is the feeling. It happens because of a stimuli and based on your own experience. The mood are more sustained emotional states. They're longer. When you wake up and you had a good sleep, a good night's sleep, you had your coffee, the roads miraculously weren't cluttered, weren't a lot of traffic on your way to work, your mood is good. And the opposite side, if you haven't been eating, if you have been standing for too long, if you haven't had a good night's sleep, your mood is affected. So sometimes we wake up feeling cheerful, and when it says like your feeling in the beginning of the day is how your day is gonna go. So if you wake up in a good mood, the rest of the day is gonna be good because you are focusing on the good things. And vice versa. If you wake up in a bad mood, your day is not gonna be that good because you're gonna be focusing on the negative or the cup half empty. Okay. Is the difference between emotion and feelings and moods clear? Okay. We have a set of primary and secondary emotions. Primary emotion, they happen in real time. So your primary emotion, it happens now. What you're feeling in the moment. If I ask you now, we have 31 people here. I'm so honored to have you all. If I ask you right now, what is your primary emotion? Do you feel joy, happiness, fulfillment, contempt, peace, fear, shame, sadness, hurt, guilt, frustration, dissatisfaction, or disappointment? It happens in real time. It happens right now. And you could technically pinpoint it. And it is a practice, it's like a muscle. You need to practice it more to understand it and distinguish between the different emotions. But it is happening in the moment, and they move us to do an action. Say you're feeling peace. Okay, I'm feeling peaceful. I'm just gonna go and grab a book and read it on your day off. Or I'm feeling joy at my work. So I'm gonna go and double check the beds or double check on my patients and so on and so forth. When it comes to the other part of it or the other kind of it, the secondary emotions are complicated and they build up. They don't happen in real time. It's an accumulative of primary emotions once and again and again and again, and then you get a secondary emotion. Normally they hinder us. So disapproval, disdain, hatred, coldness, hostile, low self-esteem, anxiety, insecurity. You couldn't feel insecure from one interaction. It's a buildup of emotions that led to being anxious or being insecure. So distinguishing these two, understanding these two as well, help you be more self-aware, have more perception of your life, understanding what you're feeling and why you're feeling them. Sometimes something really simple triggered us, and we wouldn't understand it if we didn't look inward. Okay. Next, we know how we feel. And I know this practice is not going to be popular. A lot of people don't like to do it. Okay. Repeat occurrences are secondary emotions. Yes. Did someone say something else? Okay. Next, and as I said, I know this exercise or this tool isn't going to be popular because we don't really like to write, or most people are. If you know how you feel, what does that mean? Why is it important to understand and know and learn how am I feeling right now? So the journal idea is very easy. Keep a journal and write down your state of mind, saying, when I'm angry, I yell. Some people, when I'm angry, I cry. Some people could be, when I'm sad, I yell. Or when I'm sad, I cry. When I'm sad, I eat. And so on and so forth. If you keep a journal of, like, say you can do it for a week, you will be able to understand what you're feeling and what is your reaction to each feeling. I'm sure you've heard of emotional eating. Why does emotional eating happen? It's triggered by an emotion. You're not eating because you're hungry, you're eating because someone disappointed you, or someone made you angry, or someone made you sad, or that maybe you saw something that is sad, or you went through a sad situation. It doesn't have to be someone else's fault or job. Okay. Also, when I'm hurt, I shut down. Why do we have to define them? You cannot fix anything if you don't know it. Unless you bring it to the surface, you wouldn't understand how to deal with it. And when I say fix, I say it loosely because it's not actually not trying to fix it, you're just trying to regulate it. It's not shameful to feel what you're feeling. And I'd like to touch on this point again. We tend to be really harsh and judge ourselves a lot. And life is challenging. And if you become your own cheerleader, it's easier to go through life than if you become your own judge. So what is it that I'm asking you to do is identify your reaction to each emotion. And this is just something you can do at home. It's just a practice of self-awareness. Okay. Understanding emotions, learn how to be the best listener. If you want to understand people's emotion, which makes you a good healthcare provider, it's really important to be the best listener, which means an active listener. In your field, you could, when a patient come to you and complain or give you a complaint or what they're feeling, summarizing what they said and saying it back to them is actually a practice of active listening. You make the patient feel heard. And when they feel heard, they actually feel more relaxed and they're more likely to open up, be more satisfied, and heal better. And also, you have to watch the body language, the nonverbal communications. A lot of people tend to, when they feel anxious or when they feel embarrassed, they tend to, put their arms on top of each other, cross their legs, close up their body, and this is a sign that this person is uncomfortable. So you have to understand, be a good listener, and also pick up on the nonverbal communication. The nonverbal communication is a vast subject. I can't really summarize it in this hour, but it is an important experience and an important tool that you could use. Someone could come to you and say, okay, I'm happy. Or you could tell yourself, I'm happy. But are you demonstrating the traits of a happy person? Because they could say something and their tone could tell you something else. So if you're an active listener, you will understand their emotion, not just with what they're saying, also with their tone. This could apply to yourself as well. You looking at you. Do their tones and their emotion match? Do you think that, okay, what they're feeling and what they're saying is matching, or are they opposite? Normally, you get the sense the more you do it. And of course, if you start with yourself first and then start observing others. Maybe a really important point here as well is be okay, be comfortable, be relaxed in sharing your emotions. Having an emotion is not a bad thing. And I know there's a lot of social stigma towards sharing emotions, whether it's for male or female alike. Sharing your emotions are a little bit uncomfortable. But the more you tell yourself what you're feeling, you write them down, you understand them, you are self-aware, it's easier to share them. And it's really important because, as I said, you work 12-hour shifts. These people who you work with, they're not just your colleagues, they're not just your peers, they're not just your superiors, you're a community. And if you are not comfortable sharing your emotions, it leads to feeling of isolation and burnout and dissatisfaction and so on and so forth. So we have a question here. What if I look mad, but I'm just chilling? Okay. If someone perceive you as mad, I mean, it's their perception, but if they ask you and you say it with a smile, no, this is just my face, this is just me, or maybe there's an underlining thing that's going on with you. So it depends. But being verbal and verbalizing how you're feeling is actually an easy way of clearing this misconception. Okay, how does emotional intelligence really work? Does anyone, based on what we said, does anyone have any ideas on how does it really, really work? Okay, I'm gonna tell you. Our responses to triggers is to understand what we do in a certain situation. Not solely on facts, but perception as well. That's correct. Thank you very much. So the trigger could be traffic, or someone disturbed your sleep, or someone is yelling in the next office, or a patient is yelling at the reception on the ER. A worrisome email or a phone call, an impending deadline. You have to submit something at a deadline, or bad news. These are just examples of triggers. And there are obviously a lot more, but these are just like an example. So what is your response? And this is what emotional intelligence entails. It's understanding from where in your brain are you reacting. There's a response that activates the activation of a lower brain region, which is irrational, a knee-jerk reaction, like a very sudden reaction, entirely emotional, like screaming and yelling. This is you activating the lower part of your brain, which is based on emotions, and it's like emotional oriented. When you activate the higher brain regions, you have a calm response, a combination of emotion and logic, and this is what you want to be doing, and this is what it means to be emotionally intelligent. Exactly. Being aware of your emotions and knowing how to react to triggers and the mentality of working to fix it. I tell my 6-year-old, you're when something happens and she feels guilty because she did something wrong, instead of focusing on the wrong or the mistake or the thing that didn't go well, focus on how can you fix it. And I know for a 6-year-old, this is a big deal, but it applies to us adults as well. If you focus on the problem, you're going to be in an endless loop of resentment, anger, dissatisfaction. And if this happened more than once in the past, and this is the secondary emotion, there's a lot of accumulation and so on and so forth. However, if you focus on, okay, this happened, no matter the reason is, it happened. Say someone forgot something or someone was late for a deadline and so on and so forth. Instead of focusing on why did it happen, focus on how you can fix it, because the why is very emotional. We tend to go into our heads and think, oh, they did this because they disrespect me, they did this because they don't care, they did this because they're neglectful, and so on and so forth. And we jump into conclusions, and these conclusions aren't really helping the matter at hand. What we should be doing, or what I advise you to do, is working to fix it. Instead of focusing on what happened and why it happened, focus on how can we fix it. What are the procedures, the strategies that you could do right now to fix this situation? Sorry. Okay. The key ingredient is empathy. As I said before, and I'm going to touch on it again, what is the difference between empathy and sympathy? Sympathy is very, very passive. You could be sympathetic with someone, you're just there for them, trying to comfort them, but you're not really doing anything. However, empathy is active. You're taking an action. Sympathy, feeling sorry for someone from your point of view. Oh, if this happened to me, I would feel so and so. This is sympathy. However, empathy is you understand someone's feelings as if they were yours. You're not looking from the outside. If you went through this, what would happen? How would you react? How would you want someone else to be there for you if you went through this? So instead of just looking at it from a judge, which is sympathy, you're just looking from the outside. No, just live it and empathize. But like a very, very important point, don't live the drama. Like you just want to live the feeling at the moment and then leave it there. Because a lot of people, because they empathize a lot, they tend to not get out of that state and they relive the drama of the other person or the other patient. So this is a really key distinction here. Okay. Offering unsolicited advice and passing judgments. Like I said, you're looking from your high horse, you're looking from the outside. It's like you're looking into a house from a window and you give a solution, and maybe they didn't ask for it. Maybe they just want you to listen and maybe understand the root. If they ask you a question, you could be empathetic by active listening alone. You don't have to give advice. But if you get to the root of the problem and offer comfort and advice, if asked, some people tell you what they're going through. They don't want an advice. They don't want a solution. They want you to listen. They want to vent. And it is actually one of the ways that we could manage stress. A really helpful thing is to ask if they want actual solution or just to listen. Exactly. This works. It works a lot in my personal life as well. When someone comes to me with a problem as a natural problem solver, I would tend to jump into the fix it mode. But sometimes people, they just want to listen, someone to listen to them. So I would ask, what would make you feel better? Is it just me listening, or do you want an actual advice? And so on. So ask questions to understand their feelings, how your words and actions affect other people, and anticipate how they're feeling based on their tone and their state of mind. Okay, this book is really, really good. Rewire Your Brain. It's an amazing book by John Arden. You can find it on Amazon. I'm not sure if it's in any other platform, but I know it's in Amazon. Changing your emotions, it's basically rewiring your brain to react differently to triggers or respond differently to triggers and so on. So, how does a lucky rabbit foot make you feel? Or music? Have ever music changed your mind? Has ever music changed your mind or put you in a better mood? Um, what does a picture of your family make you feel? The smell of coffee, listening to a story about someone who did something amazing, and so on and so forth. There is no right or wrong way of changing the emotion that you're going through right now. It's what works for you, and it's based on trial and error. So you need to be self-aware to understand, okay, when I'm in a bad mood, when I'm feeling anxious or sorry, angry or sad or disappointed, what would make me feel better? And try different things until you reach the thing that will help you understand what works for you. Regulating your emotion. First of all, I want to talk about what is it if you are in a dysregulated emotion state. When you are in a dysregulated emotional sign is overly intense emotions, when your reactions are very big, they're very profound. Impulsive behavior, when you tend to act before you think. Lack of emotional awareness, you're not really understanding what you're feeling right now, and you feel hesitant and you have trouble taking decisions. Your inability to manage your behavior, like you start shaking or you start blurting words. These are all signs, or avoid difficult emotions, which is the avoidant way of just like pretending the emotions isn't there, the emotion is not there, and so on. So these are all signs. If you are guilty, and I say guilty lightly, of one or two of these signs, it is, or they are a sign of dysregulation in your emotions. Okay. How do you regulate your emotions? There are like few steps you could try. First of all, identify how you feel. Give it a name. What is the feeling? And I know you're busy and I know your schedules are packed. I know it's not easy to do that all the time, but if you do it when you are free, it's easier to do it. And because we have practiced it so many times, it's easier to do it when you are busy. So first, identify how you feel. Take a moment, take a breather, walk away from the situation, remove yourself from the triggers or the triggering situation. Take a deep breath or a few deep breaths. Do, a crossword puzzle, Sudoku. This is only when you have time, obviously. Laugh, relax, print, draw, cook. These are the things that you can do to regulate it. And again, regulating your emotions does not mean controlling them. It means that you find a healthy outlet for them. All right. Benefits in healthcare of emotional intelligence. If you can see, people high EI rates compared to low EI rates, which is in the green. In all the three areas, which is patient satisfaction, adherence to treatment, and employee retention rates, the people with high emotional intelligence perform better, significantly better. All right. Emotionally intelligent people are. What are their characteristics? They're very empathetic. They care about what other people feel. They're willing to change and open to it. And the change here is not changing for someone else, it's changing for your own well being. Using the tools that you learned today and applying them into regulating your emotions on a day to day basis. Positive people that others want to be around, because you're not constantly focusing on the negatives, you're actually looking at the full part of the glass, so to speak. Focus on achieving goals with while motivating others. It's not just you motivating yourself, which is a key component in EI. It's you motivating other people to getting where they need to go, and are naturally more productive. Why is it beneficial to be emotionally intelligent in the work or in your work? On the job, people with higher EI, they excel at staying calm under pressure. And as most of you know more than me, your job is high in stress. It's very stressful. There's a lot of stressful situations that you go through, whether you're running a code or there's a meeting or something happened, or like an emergency room or something like that, and so on and so forth. If you are calmer under pressure, you are most certainly the best person to work in that environment. However, if you show a lot of dysregulating signs, it's really hard for you to work under pressure. Resolving conflict effectively, which means that you're not focusing on the why, you're focusing on how can we fix it. The problem is happened, it's happened. There's nothing you can do to change that it happened. It's already happened, but you can fix it, and you can apply the different ways of conflict resolutions to fix it. Behaving with empathy, like I said, this is the key component of EI. Leading by example, you cannot expect people to do something you're not able to do it yourself. So being emotionally intelligent and self-aware makes you learn your behavior, understand them, and therefore lead by example. So you're demonstrating these behaviors to your peers, to your subordinates, and so on. People with high level of emotional intelligence delegate effectively and more empathetically. So they are more effective in delegating. And like you know, in a team, a leader cannot do it all. One person cannot carry the team, whether it's a leader or not. So being emotionally intelligent is understanding what other people's strengths and weaknesses are, and therefore delegating more effectively. Increasing our emotional intelligence makes us better employees, leaders, colleagues, and teammates, and also affect the way you care about patients and how you deal with stressful situations. Okay. Think about an interaction or a situation at home or at work that caused an emotional response in you. That emotional response did not go well. Who was involved? And this, you could take a moment with it later. Just answer this question on a piece of paper. You will be surprised by your answer, I guarantee it. And it is one of the ways you can be more self-aware. So who was involved? What was the trigger? What triggered your response? What was the outcome? How did you respond? Based on what you learned today from all the information that I gave, what could you do? What could you have done differently? What are the things that you could have done to make it easier, have a better response, have a healthier outlet of your emotion, and so on and so forth? Could sit with this later, and I'll send the PDF of the presentation to Sheikha that she can share with you all. And as I said, you will find it tomorrow on YouTube on my channel, and I'll link that at the end. Practical strategies. Active listening. And we talked about active listening, what it means. It means that you're really there. You can summarize what the person in front of you said, their concern, voice that, tell them that you understand what they're feeling. You understand how it is, and see and ask if they want your advice or they just want to vent and let it out. Also, empathy building exercises. This is especially for healthcare professionals. You could come in a team, doctors, specialists, nurses, and simulate a patient interaction, which maybe you have to tell a patient a difficult diagnosis, or so on and so forth. Practicing these techniques with each other as a team and giving each other constructive feedback helps in raising or increasing your emotional intelligence. Regular emotional check-ins. And this is very, very important, especially in teams. There's a suggestion in one of the papers that I read that said, during a weekly meeting, the leader could take 10 minutes to ask the teammates or the subordinate of their emotional state, how they're feeling, and what could make it more or much more easier to go through a situation. Say you have a high, the shift is like there's so many patients, there's a lot of pressure. Maybe the meeting after that could be, you could discuss with your leader or with your teammates what could have made this easier. And again, when you are giving suggestions, don't start with you. Explain the situation and say how you feel. And it's very important to practice expressing your feelings clearly. Okay, this is a self-assessment quiz. I'd like you to scan the screen. You can do this after we're done. It's gonna give you an idea of how emotionally intelligent you are. It's a very quick test. Complete it, and then following the quiz, reflect on the results. Do you think it's right? Do you think it's wrong? What could you do to advance? Okay, this is a very important part of the workshop. It's a know thyself. You have to know what's your greatest strength. So what is it that you should emphasize? What is the strongest thing in your job that you could do? What can you offer? Think of several ways in which you can magnify this strength. For example, you can say, I can emphasize, my strength is empathy. So I'm an empathetic person, and I can emphasize it by listening more effectively, or active listening, and so on and so forth. This is a way of understanding who you are and being self-aware of your strengths and weaknesses. What's your biggest weakness? This is something that you should work to improve, to think of a couple of things you can do to improve upon your weaknesses. For example, my biggest weakness is I interrupt and I am too sensitive. So I can work to improve that by focusing on what the speaker is saying, not having, and training myself to not always have to respond. Like I can just listen and active listen and keep a mental note, or maybe write it down instead of interrupting the speaker. And having confidence that I am a good person, even if someone finds faults in me. Again, don't be your worst judge. Don't be the person who judges you. Be the person who motivates you. And it is also one component of emotional intelligence. Work to improve rather than feel defeated or defensive. So we all have weaknesses. We all have strengths. We could choose to what do we focus. And there's no person on green earth that doesn't make mistakes. Everyone makes mistakes. Everyone has weaknesses. So when you understand this and utilize this and saying, okay, these are my weaknesses, this is what I did wrong, and this is how can I fix it, it's better than saying, oh my God, why did I do that? Why did I do this? Why did they say that? And so on. Implementing it, how do you manage stress by implementing EI or emotional intelligence? Step away from the situation if possible. This is the first step. Removing yourself from the situation is very crucial. Focus on the in and out of your breath. Sorry, just take a deep breath in and out. And then your mind is going to start interrupting. And this is where you go, okay, I want to focus on my breathing. Sorry. This helps you calm down and gain perspective, just to give you a breather. And then if you need to vent, you can find a friend, a colleague, a peer, a teammate, a professional that you could let out. And I want to give you an advice here. You can vent, just don't overdo it. Don't vent to everyone who would listen. Just choose someone who would help you and be empathetic with you in that situation and tell them. It's easier because they could give you advice, or you could just like get it out of your chest and then focus on how you can fix it rather than just repeating the problem. Once you're calm, ask yourself these questions. How can you change the situation? How can you better cope with it? The stressful situation that happened, whatever it is. Have you ever tried some alternative ways of dealing with situations or person? It could be a difficult person, a difficult patient, a difficult teammate. So it is when you remove yourself from the situation and gain perspective where you can find the solutions, because in the heat of the moment, it's really hard to do it. We are in this fight or flight mode, basically. Okay, how do you handle criticism or attack criticism? When someone is criticizing you in not a constructive way, but in an attacking way. Just draw the critic into a conversation rather than just sitting there and taking it. So have a back and forth, have a go at the, understand what they're saying, ask them to elaborate, and not a condescending way, but not in a professional way. Tell them to voice their concern, what their main points and why they are saying what they're saying. If the critic doesn't let up, if they don't stop doing that, try to lighten the mood and not take it personally. Maybe give a little joke, comment, and just move on. And rather than to confront that critic or the person who's criticizing you, which could obviously lead to a conflict or a bigger conflict or embarrassment, or especially if you are in front of people, address the possible concern. And in your next sentences, like just summarize, repeat to them what they said in a positive tone, which is an active listening technique. Just tell them, okay, so you want me to do this or this or that, or you're commenting on this and this and that, and so on. And then check for the change in the mood. When you've shown the person in front of you that you've listened to what they're saying, they are more likely to calm down and have a different response. The most important points of today's workshop is reflect on the information that you've been given. As I said, it's going to be available on YouTube. What's the most important thing that you learned? And what is one thing you will do today to become more emotionally intelligent? Thank you for listening. And if you have any questions, you could either turn your mic on or write it in the chat. I'm very grateful, honored, and privileged that I did this workshop with you tonight. It was really fun preparing it. I have tremendous admiration of people in the healthcare profession. I commend you for your services and your amazing, amazing demeanor, and that you are and always been one of the best professional healthcare ever. Thank you very much. I'm very glad to be part of this workshop tonight, and hopefully I'll see you in different workshop in the future. This is my email, and you can scan the barcode for my YouTube channel. I'll upload the workshop tomorrow. And I'm very, very glad and grateful that you attended. Thank you very much.